We are Victoria Carolyn and T.L. Brink from Crafton Hills College. Depression during COVID, a function of cases, deaths, lockdown, or loneliness. Depression is a very serious and widespread problem, has not varied greatly over the last 2 years. This is one estimate of the incidence of major depressive disorder among adults. Sonia Lyubomirsky suggested that happiness corresponds with social interaction, especially gratitude and altruistic behaviors. Therefore, we would hypothesize that during a period of lockdown with less social interaction, the quantity of depression, the prevalence of depression would increase. People having to stay at home, feeling isolated, this would present a special challenge to people, making it more difficult to have essential social interactions, thereby provoking isolation and increased depression. There is some evidence for this already from the CDC. Considerably elevated adverse mental health conditions associated with COVID-19, specifically younger adults, racial ethnic minorities, essential workers, and unpaid adult caregivers, have reported more experiences with mental health outcomes that are adverse. Increased substance abuse, elevated suicidal ideation. We began this research with two hypotheses. One was that internet searches for depression will show an increase during the year 2020, and that this will correlate more with loneliness than with COVID-19 cases or deaths. Our method was to utilize the database known as Google Trends. This indicates the volume of searches for a specific term. The highest point of search volume is given an index number of 100, and other data points are shown in proportion to that highest point. What we did is we looked at January through July of 2020, a time series of 30 weeks. We looked at external factors such as the number of new COVID cases, the total cases, the number of new deaths, total deaths, and a measure of lockdown stringency. Now, all of these variables came from Ritchie et al. At ourworldindata.org. We also did Google Trends searches for the following 10 terms: anxious, anxiety, depressed, depression, loneliness, isolation, lockdown, quarantine, coronavirus, and COVID. Now, Google Trends permits a geographical as well as a chronological analysis of search trends. We were able to look at 210 U.S. metropolitan areas from Abilene, Texas to Zanesville, Ohio. Our data analysis was accomplished with JAST. We decided to use Spearman-Rowe rank order correlation coefficients. Now, first of all, let's look at the time series results. We see that over the 52 weeks under study from September of 2019 to September of 2020, there was a peak of searches for depression in the week of March 15th. It declined after that. So our first hypothesis was that depression would show an increase during the year 2020. That's just not borne out by the data. There was a slight rise and a slight decline. Indeed, internet searches went down as the death toll mounted. So there was no real significant correlation with the between depression and the number of new cases or new deaths, but depression had a slow decline, of course, as total cases and total deaths mounted up. Our second hypothesis is that depression searches would correlate with loneliness rather than COVID-19 cases or death. And we found that for anxiety searches, there was actually a negative correlation between the number of new deaths and anxiety searches. For depression, the searches were in the expected direction, and these searches did correlate with loneliness more than anything else, but also to a certain extent with isolation and quarantine. Interestingly enough, not with stringency. Let's also take a look at our geographical results here. The highest number of depression searches came from a small island off of Maine, the lowest for Miami. And while the number of COVID searches and coronavirus searches were correlated, there really wasn't much of a correlation between depression and coronavirus searches in these different geographical areas. The searches for depression were not more likely to come from the same locations searching for COVID or coronavirus. Now, how exactly has COVID-19 created stress that has posed mental health challenges, and what can we do about it? Our current levels of depression are more tied to loneliness than to anything specific within COVID-19. Therefore, we suggest for future research the use of more qualitative methodologies, such as focus groups and ethnographies, in addition to, rather than instead of, the quantitative approach. We're suggesting that such in-depth research will help us understand the mental state of people during this particular time. Other approaches to the future study of depression would involve embedded scales in questionnaires, such as the Beck, the CESD, or the Geriatric Depression Scale. And of course, we could look at various patient records that are being recorded during this particular period. Perhaps eventually we can look at some randomized controlled trials of different methods of intervention. These are all going to be useful pieces of the puzzle of depression during COVID. We are Victoria Carolyn and T.L. Brink from Crafton Hills.